Hi guys, we are going to see physiology of anemia in detail. Introduction, classification, signs and symptoms. Introduction: anemia is the blood disorder characterized by the reduction in red blood cell count, hemoglobin content, packed cell volume. Classification of anemia. It's classified by two methods: morphological classification, etiological classification. Morphological classification depends upon the size and color of RBC. Size of RBC expressed as MCV, mean corpuscular volume. Color is expressed as MCHC, mean corpuscular hemoglobin concentration. By this method, anemia is classified into four types. Type of anemia: size of RBC, MCV, color of RBC, MCHC. Normocytic homochromic normal. Normocytic hyperchromic normal less. Macrocytic hyperchromic large less. Microcytic hyperchromic small less. Etiological classification. On the basis of etiology, anemia is classified into five types: hemorrhagic anemia, hemolytic anemia, nutrition deficiency anemia, aplastic anemia, anemia due to chronic diseases. Hemorrhagic anemia, it's referred to excessive loss of blood. Anemia is due to hemorrhage, is known as hemorrhagic anemia or blood loss anemia. It occurs both in acute and chronic hemorrhagic condition. Acute hemorrhage means sudden loss of large quantity of blood in case of accidents. RBCs are normocytic and homochromic. Chronic hemorrhage refers to loss of blood over a long period of time by internal and external bleeding, as in conditions like peptic ulcer, purpura, hemophilia and menorrhagia. The RBC are microcytic and hyperchromic. It's because of decrease in iron content. Hemolytic anemia. Hemolysis means destruction of RBC. Anemia due to excessive destruction of RBC are called hemolytic anemia. It's occur because of this condition are renal disorder, liver failure, burns, hypersplism, infections like hepatitis, malaria and septicemia, poisoning by chemical substance like lead, coal and tar, presence of isoagglutinins like at right hand, autoimmune diseases such as rheumatoid arthritis and ulcerative colitis, hereditary factors like sickle cell anemia, thalassemia. Nutrition deficiency anemia, it occur due to deficiency of nutrition that necessary for erythropoiesis. Such substance are iron, proteins and vitamins like C, B12 and folic acid. Iron deficiency anemia, most common type. Due to inadequate availability of iron for hemoglobin synthesis. RBC are microcytic and hyperchromic. Protein deficiency, it decreases the HB synthesis. RBCs are macrocytic and hyperchromic. Vitamin B12, it's help the maturation of RBC. Its deficiency causes pernicious anemia, is also called as Addison's anemia. It's occur due to less intake or poor absorption of vitamin B12. It is absorbed from the stomach with the help of intrinsic factor of Castle, which is secreted in the gastric mucosa. Decreases in the production of intrinsic factor causes poor absorption of vitamin B12. RBCs are macrocytic and homochromic or hypochromic. Folic acid deficiency, it's also necessary for maturation of RBC. It leads to defective DNA synthesis, making the nucleus to remain immature. RBC are megaloblastic and hyperchromic. Aplastic anemia, it is due to the bone marrow disorder. The red bone marrow is reduced and replaced by fatty tissue. Occurs in conditions such as repeated exposure to X-ray or gamma radiation, tuberculosis and viral infection like hepatitis and HIV infection. RBCs normocytic and ormochromic. Anemia due to chronic diseases. It's occurred due to some chronic diseases such as rheumatoid arthritis, tuberculosis and chronic renal failure. RBCs are normocytic and ormochromic. Signs and symptoms of anemia: skin and mucous membrane. The color becomes pale. Paleness is observed prominently in buccal cavity, pharyngeal mucous membrane, conjunctive, lips, earlobes, palm and nail bed. Skin also loses the elasticity and becomes thin and dry. Hair and nails. Loss of hair is common with thinning and early graying. Nails brittle and easily break beel. Cardiovascular system. Increase in heart rate and cardiac output. Cardiac murmurs are produced. The velocity of blood flow is increased. Respiration, rate and force of respiration increase. Sometimes it leads to breathlessness and dyspnea. Oxygen hemoglobin curve is shifted to right. Digestion, anorexia, loss of appetite, nausea, vomiting, abdominal discomfort and constipation are common. In pernicious anemia, atrophy of papillae in tongue. In aplastic anemia, necrotic lesion appear in mouth and pharynx. Metabolism. Basal metabolic rate increases in severe anemia. Kidney. Renal function disturbed and albuminuria is common. Reproductive system. In females, menstrual cycle is disturbed. May be menorrhagia, oligomenorrhea or amenorrhea. Neuromuscular system. Symptoms are headache, lack of concentration, restlessness, irritability, drowsiness, dizziness or vertigo especially. When standing, increased sensitivity to cold and fainting. Muscles become weak and the patient feels lack of energy and fatigued quite often and quite easily. Thanks for watching DENTOLOGY Notes. Please subscribe.